everyone. I am the chair of the Health Committee of the NAACP Williams-Bridge branch. We are so excited to have you here. This is our first virtual meeting, and we look forward to your participation and to hearing our distinguished guests. So, we'd like to begin. We have a very robust and ambitious agenda, and we'd like to make sure that we cover everything that we'd like to cover by 5:30. So the first thing that I'd like to do is to welcome all of our attendees. We appreciate all of our family, friends, colleagues, and including all those associated with our presenters and collaborators of Columbia University, as well as those associated with the NAACP and the Williams-Bridge branch. We'd also like to welcome all the other representatives who are here from many other organizations who provide public service to our community. Thank you. So I just want to make sure that everyone is aware that this webinar is a labor of love and a collaboration between the NAACP Williams-Bridge branch and Columbia University. We would not have been able to have this webinar if we did not have the help from beginning to end from the team from Columbia University. Specifically, we had help from Vanita Gowda, who is the Chief Communications Officer from the Columbia University Mailman School of Public Health. And we also had help from Linda Muscat Rim, who is the Associate Dean of Marketing and Strategic Communications from Columbia University School of Nursing. We thank you, and we're so grateful that you were so willing to participate in this event. So first, we'd like to just review the goals of this webinar. First, we'd like to provide, of course, as much up-to-date information as possible about the COVID-19 vaccine and their safety. We have supposedly 3 vaccines available now. We'd also like to discuss the apprehension many people have regarding the vaccines, especially those in communities of color who feel the medical community cannot be trusted. And lastly, we'd like to discuss how we can improve our relationship with the medical community overall. So before I allow our president and our state health chair announce themselves and share some information, we just want to quickly remind everyone, you may already know that the NAACP, or the National Association for the Advancement of Colored People, was established in 1909 and is one of America's oldest and largest civil rights organizations. The NAACP Williams-Bridge branch, which we are a part of, was established over 50 years ago to support the overarching goals of the NAACP, and we are specific to the Williams-Bridge section of the Bronx, which is Community Board 12 and covers zip codes 10466, 10467, and 10469. We also have a daycare center. Just want to remind everyone we're on Facebook, and we ask that you like and follow our Facebook page. So first, I'd like to introduce the president of the NAACP Williams-Bridge branch, Mr. Julian McDavid, and I'd like for him to offer welcome address to all our participants. You have the floor, President McDavid.
Thank you all. Thank you for this wonderful expression of community efforts and community help. I do appreciate what you're doing, Chairperson Iwan. This is a good thing for the community. We get all this information sometimes by the radio and the television, but it's good that we can sit down together. Well, not sit down together, but be together to go over some of these paragraphs from experts who can help us more in our community, and most importantly, to remove the fear that some of us still carries in our heart for this vaccine. I must tell you that I have been a member of the NAACP since 1967 when I was stationed in Fort Jackson, South Carolina as a soldier. I was there and I got introduced to NAACP, and I'm still NAACP. I've been going to the NAACP on Williamsbridge, 219th Street. When I came out of the service in 1969, I'm still there. Everywhere you go, I'm still there. But I'm doing my best to move this branch to other levels, and I appreciate all that the chairs are doing. Not only your chairmanship, but other chairs, that we can do more and more. But due to the fact that the COVID-19 has slowed us down quite a bit, but we are capable of moving forward in every way because we have the technology now to talk to each other. So I am very delighted to be in the midst and to share my views if there are any, and to give congrats to you and your committee for bringing this meeting up front. Thank you so much.
Well, we thank you as well for sharing that, President McDavid, and we thank you for your tireless commitment and work to our community in the Bronx and to the civil rights movement, which I know that you were very involved in. And we love you and we appreciate you, and we would not be here if it wasn't for you. So we thank you very much. Next, I'd like to introduce Ms. Lorraine Brathwaite Hart. She is the health chairwoman for the New York State Conference, and she will share with us the NAACP's role and position regarding the community efforts regarding COVID-19 and the vaccine. So you have the floor, Ms. Brathwaite.
Good afternoon or good evening, and thank you so much for inviting me on. This is a labor of love, I should say. As we do all that we do and commit so much of our time and efforts free of charge. No one pulls us and tells us you have to do this. We do it because we care about our communities. And the NAACP has been a force for me to reach out to those whose voices cannot be heard. I started out in 2009 and I hit the ground running, I would say. And I have never looked back, and I continued to give. Started out as a health chair, vice chair, and then I became the chair of the Brooklyn branch, and then I became the state chair. So as a state chair, it gives me a great opportunity to educate, to be able to be out in the forefront. Right now, our role is to let people understand that the NAACP stands for factual issues. We are a social justice organization, and we want to educate our community on what the facts are. There are so many misconceptions and things that are being said about the vaccine that is not serving our community very well. So to that end, one of the things that I do every time I get an opportunity to speak, since the issue of the terrible treatment of Black and brown people by the medical institutions, of which you will hear more in depth from the other doctors that are on this on this panel, and they are in the trenches dealing with this. You will hear more in depth. I would like to speak to you just briefly on the brief history on what has brought us to this the issue of not trusting the medical system. Just looking back at every time I hear it is the Tuskegee study. Understand that it was a study, right? Started in 1932 in the backwoods of Alabama by white doctors, white researchers. They just wanted to study how syphilis affected Black males. So they rounded up 600 of them, some of which had syphilis, some of which did not, because in order to do a proper study, you have to know how to compare the two. And this study started in 1932 when there was absolutely no cure for syphilis. But the sad and egregious things, there are two factors that really hurt me and hurts everybody to hear the story, is that the Tuskegee Institute, which is today now the Tuskegee University, also played a role in this research. Black doctors and nurses knew exactly what was happening, and they went along with it. You probably will hear more in depth as to what they lobbied the U.S. Congress for this to happen through the United States Health Department. I think it's something like that. But the point is that we were part and parcel of the whole problem. Move forward from 1932 to 1947, penicillin became available, and it was the medicine of choice to treat syphilis. Yet those men were not given an ounce of penicillin to stop their sickness. Men died, they spread it onto their wives, and the disease continued to spread among them, and nothing was done. Fast forward to 1972. Now I am born, now I am in high school, now I know about this, and I'm not part of, I was not born in this country, but it was all became part of what I understood. And that is part of what drove me into the civil rights issues, also understanding what has been happening. So for 40 years, this study occurred and nobody did anything until it was openly made aware to us. There are so many other stories similar to that we need to understand. That was a study where nothing was done. Today, fast forward, COVID-19 vaccine is a preventative measure. And as far as the NAACP is concerned, we want people to understand the difference between the syphilis study where nothing was done and there was a solution to COVID-19 where COVID-19 vaccine can prevent you from getting the disease. We can't tell you what to do. We can only present to you the facts, and that's why forums like this are being done, so that our people can understand why the vaccine was made. Seems like it was made very fast, but no, over 10 years of studying the Moderna vaccine was in effect. So therefore, this is nothing new. We've been here before where vaccines had to be rushed to be made. Okay, so I am happy to be part of this, and I would like to leave you with two books that will help you to understand the social determinants of health that have brought us to this egregious condition where Black and brown people have been the worst affected by disease. It is not by chance that it happened, it's by design. So the first book I like to show you is The Color of Law. Okay, this is a very important piece of information book because it's a resource that teaches you about how Black and brown people were channeled to live in highly congested areas. Okay, and therefore making it very difficult for you to have quality of life. The second book is The Political Determinants of Health by Daniel E. Dawes. Politics determine how health is going to be administered. You can have ideas, but if you don't have political push in what you're doing, and the NAACP is very strong with pushing political agendas. Politics are at the root cause of why we are where we are. So I hope that in giving you this information in closing, it will serve you to become more educated as a community to understand why we are where we are. Thank you very much for this opportunity.
Thank you so much, Lorraine. We appreciate and understand those comments, and we're looking forward to having the presenters expand on the history of vaccines and what the medical community has done in our relationship with them. Thank you. So I'd like to use this time to share information about our presenters. Our presenters are Dr. Kelly Bryant and also Dr. Robert E. Fullilove. So before I turn the floor over to them, I would just like to share some information about their backgrounds. So Dr. Kelly Bryant will be our first speaker, and Dr. Bryant is the Executive Director of Simulation and an assistant professor at Columbia University School of Nursing's newly accredited Helene Fuld Health Trust Simulation Center, where she oversees the day-to-day operations of simulation-based education for all the graduate nursing and advanced practice nursing students. She has over 20 years of teaching experience and 10 years of experience as a women's health nurse practitioner and is considered an expert in the field of simulation through her experience designing simulation centers for 2 of the top-rated nursing schools in the country. As the medical director of Columbia University's Nursing Opioid Overdose Prevention Program, she provides naloxone training for over 1,500 health profession students each year. She is a member of the Society of Simulation in Healthcare and International Nursing Association of Clinical Simulation Learning. She's the recording secretary for the Greater New York City Black Nurses Association, and she's the treasurer for Alpha Kappa Alpha Sorority Incorporated, Pi Phi Omega chapter serving Northeast Queens. She received her associate's degree in nursing from Hudson Valley Community College. She has her bachelor's in nursing and a master's degree as a women's health nurse practitioner from Stony Brook University. And lastly, she received her doctorate in nursing education from Case Western Reserve University. Our second presenter, Dr. Robert E. Fullilove, is a public health researcher and civil rights activist based in Washington Heights. He's the Associate Dean for Community and Minority Affairs and Professor of Clinical Socio-Medical Sciences at Columbia University's Mailman School of Public Health, where he has taught since 1990. He has been awarded the Distinguished Teaching Award at the Mailman School of Public Health 3 times in 1995, 2001, and 2013. He earned a doctorate in education from Columbia's Teachers College. He was part of voter registration efforts in Mississippi as part of the Mississippi Freedom Summer. In '95, he joined the National Academy of Medicine and has served on various high-level committees for the Academy, including those which focus on substance abuse, addiction, and HIV. Since 2010, he has been teaching public health courses in 6 New York State prisons as part of the Bard College Prison Initiative. And today he serves as a senior advisor to the Initiative's public health program, which has more than 300 students registered each year. So amen. And we want to thank Dr. Kelly Bryant and Dr. Robert Fullilove for their service and commitment to their professions and to the community. And without further ado, I'm going to turn over the floor to the people that you came here to see. And first up is Dr. Kelly Bryant, and immediately following will be Dr. Robert Fullilove. Dr. Bryant, you have the floor. Thank you.
All right. First, I want to thank you, Tanya, and NAACP, and Linda and Vanita for putting this presentation together. And it's an honor to be here today presenting with Dr. Fullilove also. So I'm going to get started. And my purpose here today is really to give you the facts about the vaccine. I want to be transparent. I have received the vaccine. I've gotten Pfizer 2 doses over a month ago. And my role in this whole pandemic, I am a professor at the School of Nursing, and we have our students, with the help of my wonderful staff, 114 students are trained to give the vaccine and are currently giving it at the Armory. I also myself have been giving vaccines out to the Washington Heights community. And been doing a lot of these presentations just to spread awareness about the vaccine. Because as you know, there's a lot of myths out there, and we want to make sure that we're spreading truth and facts about it so people can make an informed decision. So first, I don't want to bore you with a lot of statistics, but I do think it's important to share just a few. As you know, last week we crossed that threshold where 500,000 people died worldwide from COVID-19. In New York alone, we had over 717,000 cases. I updated this yesterday, and over 29,000 deaths. And that's just in New York City alone. And just to show you, this is what we call a heat map to see where the highest rates are. And so people, I know everybody's from all over, in Queens, Richmond Hill, South Zone, the Bronx, Broxdale, Parkchester. These are the sites currently that are trending that have the highest rates of COVID-19. And in Manhattan, which has the lowest rate, but still Washington Heights, where I work, has one of the highest rates. And let's look at, we know, you watch the news, there is definitely disparities going on in all areas when it comes to COVID-19. The number of cases is much higher in communities of color. The number of hospitalizations, and if you look at this map here, Black people and Hispanic Latino people, 3.7 and 4.1 times higher rate of being hospitalized due to COVID-19, and almost a 3 times higher rate than white people of dying from COVID-19. So there are great disproportions when it comes to this pandemic. And let's talk about the vaccines. We're also not receiving the vaccines at the same rate. So when you look at this map, again, updated yesterday, we have only 13% of the Black population in New York City have been vaccinated, and the Latino Hispanic population, 16%, even though Black population makes up 24% of New York City residents, and Hispanic and Latino 29. So you can see, again, there's a discrepancy between the rates at which our communities are receiving the vaccines. And we know it's multifactorial. There's a lot of reasons why, and some of it is, as we discussed earlier, there is vaccine hesitancy, and rightfully so. People don't trust the vaccine. So when they did a survey, they looked at the top reasons why people are not receiving the vaccine. And the number one reason among Black community was worried about side effects. People say the vaccine is too new and they want to have this wait and see approach. Let others get it first, and then I'll see how that works before I get my vaccine. Or simply they just don't trust the government research to make sure that the vaccine is safe and effective. Could be politics. And again, a lot of it is that mistrust due to all those medical atrocities that have happened in the past. So what I'm going to do is I'm just going to go through a lot of those common questions, and a lot of these were on that wonderful list that I received. So hopefully I can address a lot of the questions right through this presentation. So let's address the first one. Are the vaccines safe? So, you know, it did come out fairly quickly, and that's caused concern for a lot of people. But one thing we will say, the vaccine went through all the necessary steps, the same steps that FDA goes through with any medication, any vaccine. So they did test it in healthy people. They tested it in several hundred volunteers. Then they tested it in even more people. And it was approved after that phase 3. And now we're still continuing to monitor. 68 million people have received the vaccine, at least one dose of it so far. So that's a large amount of people. 66 people have had what we call anaphylactic shock, which means a severe allergic reaction. The good news is that no one has died due to the allergic reaction, and there's no direct deaths associated with the vaccine. However, I know you listen to the news and you hear somebody got the vaccine and 2 days later they died. But again, all those cases are being researched to see if there is in fact a correlation with the deaths, because you know, a lot of people got vaccinated. It could have been that, you know, it had nothing to do with the vaccine. It was just that person's time and something caused that person to die that's not related to the vaccine. So again, all those cases are being looked at, but nothing definite as of right now. Is the vaccine effective? Does it work? So as you all know, Johnson & Johnson was approved yesterday. So I have included that in this presentation. So we now have three choices when it comes to the vaccine. So yes, they are effective and they have different rates of effectiveness. Pfizer and Moderna, as you know, is 2 shots and they're both about the same. Pfizer 95% effective and Moderna 94. And that is against mild, moderate, or severe cases of COVID when it comes to Pfizer and Moderna. With J&J, I know there's been some concerns because it has a little bit of a lower effectiveness, and it does have effective 72% in the US from moderate to severe cases of COVID. So although it's not as effective, it still offers protection and it has some advantages over the other 2 vaccines. And then let's just say, look at in general, when we think about vaccines, let's look at our past. Vaccines aren't new. They've been around for a long time. And this is to show you that vaccines, in fact, do work. We were able to eradicate smallpox due to vaccines, diphtheria, measles, mumps, all those vaccines that we received when we were children and still receiving to this day. You can see through the numbers that it does work. In a lot of cases, it hasn't gotten rid of all of the cases because there are people that still don't receive the vaccine, but you could see that there's a significant decrease in these diseases once people started receiving vaccinations. Another concern. How was the vaccine developed so quickly? People say, well, HIV has been around a long time. We don't have a vaccine yet. So how were we able to get a vaccine so quickly for COVID-19? And there's a lot of reasons for that also. Number one, coronavirus is not new. Coronavirus has been around a long time. When coronavirus first hit China, they took it and they sequenced it. So they kind of got all the genetic information, knew as much as they could about the virus, and they started looking for solutions. And the one thing that was unique, people shared information. Unlike any other vaccine, people want to keep it to themselves and be the first. There was a lot that was shared. And the government, because they were so eager to find a solution, they dumped a lot of money into research for COVID. I'm talking billions of dollars to help these companies develop this vaccine, help them with production, help them with research. And then another unique thing, they started making the vaccine while the vaccine was still being produced. Usually that's a no-no. You don't want to start producing something while you're still testing it in case it doesn't work and you have to throw it out. In this case, they were so confident about the vaccine, they were making it as they were testing it, and thank goodness it paid off. So as soon as it was approved, they had it ready to ship out, ready to go. And the other main reason they were able to get this out so quickly is because so many people joined the research study. People were eager to help one way or another. So they didn't really have a lot of problems recruiting people for the research studies. Has the vaccine been tested, particularly on enough people? And then we're going to also look at people of color. So when we look at Pfizer, we had 46,000 people enrolled, Moderna 30,000, Johnson & Johnson 45,000. So a good amount of people did receive it during that trial. And there was a combination of people from all different races, people that had underlying health disorders. But as you can see from Pfizer, Moderna, still not the same percentage of African Americans and Hispanics as the general population, but they did have some in those studies, as you can see from here. And these are the studies across the world, not just United States. And then people are worried about the side effects. You hear people that get the vaccine and you probably have heard all kinds of side effects. What I'm going to cover are the side effects that have been documented through the research study. So the number one side effect people are going to have is pain. It does hurt in your arm when you get that shot. And that's pretty high. We're talking about 84%, 91% of people are going to have that injection site pain. My arm was hurting for 3 days. I'd sleep on my side. I was not able to sleep on my side for those 3 days. So that injection site pain is real. Fatigue is another common one that most people experience. Headache, muscle pain, joint pain, chills, fever. And we are aware these signs and symptoms may sound a little bit like COVID, but I guarantee this is not COVID. This is side effects from your body producing the antibodies from the injection. So the side effects are usually worse with the second dose. Older people tend to fare better with the side effects. So we recommend, like, when you're getting that second dose, probably don't schedule anything. If you can, don't go to work. You just have to relax, drink lots of water, rest. You can take Tylenol, Motrin, but these side effects are expected and they do go away in about 1 to 2 days. So we want to be transparent and tell everybody, yes, plan to expect that you're going to get some side effects. If you don't, that's wonderful. I did not have any side effects after my second one besides the joint pain, but I know a lot of people who, had to take that next day off because they just felt terrible after that second dose. What are the long-term effects of the vaccine? And to be honest, we don't know. This vaccine has been out since summer of 2020 when they started giving out the trials. We don't have enough data to really say what's going to happen 5 years from now, 10 years from now. What we know is we can go based off similar vaccines, similar results of those studies, and that they're continuing to monitor to this day. There is a great app. Any of you that go get the vaccine, I recommend that you download this V-Safe. That is from the CDC. They will send you text. They will check up on you. And you want to report any signs, any problem, side effects that you have, because we want the government, as soon as something starts looking, like we're starting to see a lot of certain side effects or something's dangerous, so they can do something about it right away. But as of right now, there's no current major concerns. Is it safe for me to get the vaccine if I have underlying conditions? We're aware people have disorders, people have cancer, people, have diabetes, high blood pressure. And one thing we want to understand, you have to weigh the risk and benefits. People who have these underlying conditions, if they get COVID, they're more likely to have adverse effects of COVID and more likely to die because of those other conditions. So being vaccinated prevents them from getting COVID-19. So it is not contraindicated. So even if you have these disorders, you can still get the vaccine. If you have any questions, you're in doubt, always talk to your healthcare provider. The only people who should not get the vaccine, if you have a known allergy to any of the ingredients, particularly something called PEG, which it's found in a lot of different things, but if you have a known allergy to that, or you received the first vaccine and you had a severe reaction, then of course you shouldn't have the second one. But again, even with certain conditions, you still can get the vaccine. And then pregnant women or people who are thinking about getting pregnant in the near future, breastfeeding mothers and children. This comes up a lot. Can they get the vaccine? So we're going to break each one of these groups down separately. So vaccines and pregnancy. Yes, pregnant women can get the vaccine. I've seen plenty of women when I was at the Armory giving out vaccines, they work with COVID patients. For them, that risk of getting COVID during pregnancy is way far greater than them getting the vaccine, the risk of getting the vaccine. So again, it's a personal decision, but Association for Obstetrics and Gynecology is not pushing it per se, but they said we should not be withholding it from pregnant women. It was not tested on pregnant women because purposely it's a vulnerable population. They're not going to test it on pregnant women right away or children because of that. But pregnant women have received it. They haven't seen any adverse effects from pregnancy. And it's not, it doesn't cross the placenta, it doesn't harm the fetus. So it is, again, up to the person whether they want to get the vaccine, but pregnant women can, and they can get the vaccine while breastfeeding. It's not going to cross into the breast milk. Again, any doubt, someone should speak to their healthcare provider to help them make that decision. What we do know is that if you get COVID during pregnancy, it actually has worse effects for pregnant women. They tend to have a more severe illness from the COVID-19 virus. And then the same thing I talked about, if you're planning on having a baby, there's a lot of myths out there, not just for the female, but it'll affect the man's sperm count. But there is no evidence that the vaccine can make you infertile. It's going to affect your sperm count or harm a fetus. And as a matter of fact, getting COVID while in early pregnancy can actually result in stillbirth and miscarriage. And then the vaccine for children. So currently the vaccine has not been tested in children and is not being administered in children. Pfizer, people as young as 16 can receive it. Moderna and Johnson & Johnson, you have to be at least 18. And the reason being is that children are vulnerable populations. We don't want to come out and test new medications, new vaccines on children right away. So we do the adults first. And right now, as we speak, they are actually testing the vaccine on children. Both Pfizer and Moderna have trials. Pfizer's doing 12 to 15 and Moderna's doing, I think it's 12 to 17. And the trials are full. They have enough children in those trials. And once that's proved effective, they'll have to go through the same process and get FDA approval before it will be on the market, because children's immune systems are different also. So we want to make sure it's safe before we start giving it to our children. And then another common question we get, what are the differences? You hear about Pfizer, some say this one has less side effects, this one's better. Someone came to me and said, I want the one Dr. Fauci had. So, and now we have this Johnson & Johnson. So we have a third one on the market. One thing I will say is that when you go to these vaccine sites, you really don't have a choice. So you get whatever is available that day. The vaccines are free too. I just want to make a note. You do not have to pay for the vaccines, but there are differences in the vaccines. Pfizer and Moderna are 2 doses. Johnson & Johnson is only 1 dose. The way they were made was different, which we'll talk about. With Pfizer, you're going to get your injections 3 weeks apart. Moderna, you get your injections 4 weeks apart. They're both, like I said, very effective. But don't think once you get that second dose, you're good, you're covered. You still need some time for your body to make those antibodies before you can kind of be considered covered. So even after that last dose, you still want to wait at least 7 to 10 days before we can say that the vaccine is working, and 2 weeks after your last Moderna shot and Johnson & Johnson. So again, age range, you have to be 18 and older for Moderna, Johnson & Johnson, and Pfizer 16 and older. I already had COVID-19. Do I still need the vaccine? And you hear that a lot. I have antibodies. Why do I need the vaccine? I'm covered. I have natural immunity. Yes, you still should get the vaccine. And the reason being is, again, we don't know enough about even the immunity you have from the infection. We don't know how long that's going to last. People have gotten reinfected with COVID. They've gotten it twice. So it's thought that the vaccines offer you longer protection than if you had the virus. It's still recommended, even if you had COVID-19, you still can get the vaccine and should get the vaccine. Will the vaccine alter my DNA? People think it's going to get injected, it's going to go in there, and it's going to change their genetics or their cells. And the answer is no, that's not how these vaccines work. They don't interact with your DNA in any way. They're not live viruses. So again, it cannot give you COVID-19 infection. And some people want to know specifically, this might be a little bit too much going back to biology class, but I thought this was a great short video just to explain what the vaccine is and how it was made. So I'm going to play this video. So that's just a quick, you take a little piece of the virus, not the whole virus, not the live virus, introduce it to your body, produces these spike proteins, which produce antibodies, so that if you're ever infected with the virus, your body recognizes it and it starts to attack that virus. So that is kind of how messenger RNA vaccines work. Another big question that's been coming up a lot, because you've been hearing on the news, there are different strains now of COVID-19. You got the UK strain, the Brazil strain, Brazilian, South African, and now we have one in New York, this B1.526. So again, will the vaccines work? Will they not work? It's still being studied as we speak. And as you can see from this map, they're kind of, every day you turn on the news, there's another variant or it's spreading. And the problem with these variants are they're not necessarily stronger, but they're easier to transmit, and they spread much quicker. So the more cases, the more deaths you're going to have. So this research shows that the vaccines do offer some protection. Vaccines aren't all or none. It's not that you get it and it's going to block the virus or it's not. Sometimes, even if the vaccine doesn't protect you 100%, if you get infected with that strain, it might give you a much milder case of COVID-19. So with that being said, it's still advised to get the vaccines, even if, you're starting to hear that it's not as effective against these other strains. And there may be that, a year from now, 2 years from now, we may have to get a booster to kind of cover us from these different strains. But again, it still should not be a reason not to get the vaccine. Can you get COVID-19 from the vaccine? As we discussed before, no, it's not a live virus. It cannot give you COVID-19. And I want to share with you, how do you sign up to get it? Because it can be difficult to find an appointment. People have been getting online. They can't find sites. They're filling up. There is a new site. If you live in the following zip codes, particularly Washington Heights, South Bronx, there's a number that you can call, which I listed here and hopefully put in the chat, where they help you make an appointment if you call Monday through Friday. You also have websites. There's the main one. The first one is from New York State. People have complained that those websites are a little bit complicated. There's a new one now, that second one, Vax4 NYC, that's easier to use. And then also, if people are not on a computer, there is a number you can call and they will help you make an appointment. And that number is in multiple languages, that 1-833 NYS 4 Vax. And who can get the vaccine now? So the first group was a while ago, and that was all your essential workers. We're currently, as of February 15th, now any age can get it if you have certain conditions. And those conditions, are pretty wide. Cancer, kidney, liver, if you have asthma, COPD, high blood pressure, if you have diabetes 1 or 2, if you had stroke or neurological conditions, you are now eligible to get the vaccine. So anyone, any age with these conditions can get the vaccine. And then last, I just want to end, again, we know that this is a hard decision for people to make. And we know people are at the spectrums. You got people who are downright, I don't trust the system, I'm not getting the vaccine. You have a lot of people that are in the middle, which I'm going to wait and see. People used to joke with me, I'm going to wait to see if you, grow a tail or 2 heads. And they're watching to see if other people get it before they make that decision. And then you have people like my mother who are trying every which way to get the vaccine because they want that protection. They want that anxiety lifted off of them, knowing that they can leave their house and not have to worry about getting COVID-19. For me, I'm a healthcare worker. I work with a lot of students. I had every day I left. And for me, the decision was, I thought the risks were minor compared to the risk of getting COVID-19. I was willing to deal with those side effects because I wanted that protection. I was tired of being scared every time I walked on the subway, every time I got in the elevator, every time somebody coughed. So that was a decision I had to make. So I advise people, do your own research and use reliable sources. Anybody can put up a web page. Anybody can post anything. Go to the CDC website. Go to the New York State COVID-19 dashboard if you want to find the latest, statistics or information. Try to avoid the myths. I've heard everything from you'll get injected with a microchip, and when in doubt, speak to your healthcare providers. Everybody has somebody in their family who's a doctor or a nurse. Ask someone who has more information if you have questions. And then again, that's a personal decision. You got to look at your risks, weigh the risk and benefits so that you can make an informed decision. And then you heard a lot about herd immunity on the news. And, one way that we can finally get these numbers down is we have to reach herd immunity. So just want to quickly talk about what that is. And that is that if we have enough people vaccinated, it's going to slow down the infection rate. There won't be as many people to get infected, and it'll stop the spread of COVID-19. But the only way to get to that is that 70 to 90% of the population needs to be vaccinated or have immunity. Right now, we have a ways to go. We're only at 12.5. So when you get the vaccine, think of it as you're doing it for yourself. You're doing it to protect your family members, but you're also doing it for the community to help get to this herd immunity. And lastly, I just want to end on, even if you get the vaccine, you still need to protect yourself. The vaccine can prevent you from getting COVID-19, but you can still carry the virus. You can still carry the COVID-19 in your nose. It may not affect you, but you can still spread it. So that's why it's still important, even with the vaccine, you still want to wear your mask. We still want to practice, social distancing, hand washing, disinfecting, all of those things that we've been doing. Just because you get the vaccine doesn't mean we don't have to, maintain these practices. And that is my presentation and my contact information. If anybody wants to reach me or even after this have any questions, please feel free to contact me. And thank you for your time and being here today.
Thank you so much, Dr. Bryant. We really appreciate all the information that you shared, and I really appreciate you going over some of the questions that were submitted to you already. I think that was a very thorough presentation. Thank you so much.
My pleasure.
So next, we're going to give Dr. Robert Fullilove the floor. You're up, Dr. Fullilove.
Thank you so much. let me extend my own thanks for the invitation to participate in this forum. And let me also, as a professor and as an educator with a long history of teaching, let me just say that Professor Bryant's lecture, her talk, her conversation with us was among the best that I've heard. It has covered so much ground in such short space of time. I really do want to make sure that as an elder in the teaching community, I recognize true excellence when I see it. Dr. Bryant, that was just great. Everybody, you heard me identify myself as an elder. And like Dr. Bryant, I want to be clear about how much we want to be about full disclosure. You might have noted that Dr. Bryant is very, very careful to have you understand that this vaccine is not perfect. You are not guaranteed that if you take it, you will not get sick and you won't be hospitalized or worse. That's not what we're trying to say. We recognize that everybody who has not been vaccinated has a decision to make. And that decision is this right for me? We've tried to argue that it really is right for you because this pandemic, this virus, has really proven, as she pointed out, to be quite deadly in our community. And we want to make sure that more than anything else, if there's something that works, if there's something that could keep us safe, if there's something that could keep our children, our grandparents, and our neighbors safe, we should be about that. We should not let the doubters keep us from something that could really help us in a time of need. Like everyone else, I've been careful to watch what's been happening with all of our efforts to make sure that everyone, especially in the Black and Latinx community, has access to these vaccines. And I, too, have been very, very difficult, that it has not always been easy, and that a lot of the reasons that Black people have not been vaccinated isn't because they have doubts. It isn't because they haven't tried to get it. In too many instances, it has been made very difficult. But I think it's also the case that things have gotten a lot better. And because things have gotten a lot better, now is the moment when you should start to consider whether or not people you know who've had the vaccine are doing okay. I had the Pfizer. I've had both doses. My second dose was on February 10th. So I'm now at that point where I can expect that I've got some protection that will come about as a result of an immune response that will have been created by having these injections. I'm 77 years old. I know I don't look it, but I've been around for a while. I have hypertension. I have a history of congestive heart failure, for which I had open heart surgery. I'm one of those folks who's at risk, but I'm also someone who is from a family of doctors. We go back a long way. In my family, interestingly enough, this is our third viral pandemic. Some of you know that in 1918, the United States, the entire world was hit by something called the Spanish flu. Spanish flu killed roughly 60 million people worldwide. My grandfather, Dr. Robert Fuller Sr., was practicing medicine in the Delta of Mississippi, based out of Yazoo City, for those of you who have roots in the SIP. In 1918, he was caring for people in the Delta who were infected with the Spanish flu. It killed his wife, my grandmother. And my father, I'm pretty sure, became a doctor in part because he really understood that his father, was not able to save his mother, but he really understood that there were incredibly important benefits to our community by having us be in a position to have access to healthcare that would be provided by Black physicians. I started doing HIV/AIDS research in 1986, it's 35 years ago. So the second viral pandemic of my family's history was one where I was heavily involved in trying to understand what we could do to limit the impact that HIV was having in our community. Some of you know that AIDS has been, for many, many years, one of the #1 killer of our young people. So the idea that this too was a pandemic that hit our community hard, that we were the ones who were most likely to be infected, the ones who were most likely to die, has meant that the same conditions that we saw at the beginning of the 80s with HIV are now the conditions that we're seeing at this point with COVID-19. I'm very clear that as someone who survived the whole process of getting inoculated, I had no real side effects at all other than the sore arm. I'm pretty clear that this worked for me. And I think for everybody who has been waiting to see whether or not somebody they know is doing okay, count me as one of those people who's doing okay. And maybe you want to consider that, I had real reasons, since I am in unbelievably good health, to do what I could to protect myself, especially since, as nearly as I can see, there are very few people in the world who are naturally immune to COVID-19. If it could impact and infect the Prime Minister of England, if it could impact and infect somebody like Donald Trump, about whom I will say nothing more, I think it becomes very clear that everybody is at risk. And maybe too, you have heard that in some communities where we've started to open up the opportunity to get vaccinated to people in the Black community. I'm told that 104th Street a week ago, when they were really clear that they were trying to impact the population of folk in Harlem, they had a line around the corner to make sure that access to that vaccine was going to be there, but it was all white people. I think if it's clear that they will come into the Black community to get something that was supposed to be for us, maybe that's evidence that this thing actually works. Because if they want it, their fears that it's about wiping them out are quite different than I think the concerns that many of us have had. So I'm trying to be very clear that this is a moment when we are trying to give you the best information possible to make sure that you make an informed choice. We're not trying to sugarcoat it. Dr. Bryant was very careful to point out that it is not a guarantee that if you take it, you'll never be touched by COVID-19. But if you're like everybody else, very good at playing very strong odds, the odds that this vaccine will work, that it will have an impact on our health and the health of our community, is something that I think you just can't ignore. And as more and more time passes, and it becomes clear with millions of people having been vaccinated, that there have not been massive waves of death, people not been dropping dead in the street, it should be clear that at the very least, this is something that we should think about. Now, I have a very brief set of slides that I want to present. I'm very intimidated by how well Dr. Bryant's slides worked. I've got just a few. And I want to be clear that I think it's important that we understand where we are in all this. This is something that I hope deserves some really careful attention. I want you to note that what happens is you're seeing something that talks about how many people are saying, I'm going to wait and see before I decide to take COVID-19. So what is it that you see here? Well, number one, starting in December, the number of people who have been vaccinated has been growing very gradually. It's also clear that the number of folk who've said that they'll get it as soon as they can has been growing as well. And even better, the number of people who say that they're going to wait to see how it's working, that number has been going down. But then when it comes to the folk who are only going to get it if it's required, and they're definitely not going to get it, those numbers have not changed very much. So that's what is happening if you look at everybody in the United States who's covered by these numbers. This is what happens when you look instead at the number of folk who say, I'm going to wait and see. What do you see at the top? That the group that is the largest saying, I'm going to wait and see, they're the ones who are basically hesitating. It's Black adults. It's us. And it's also the case that the folk who are least likely to be saying that are the folks aged 65 and older. Because I think we're very, very clear that the last thing you need is the kind of illness that's going to leave you choking and gasping for air. If I may just speak for all of the folk who are in the audience who are over 70, that's one of your nightmares. That, at some point in time, you're just not going to be able to take in a breath. And because we've seen how many people have died in hospital rooms, unable to be with their families, with someone holding up a cell phone so that their last moments could be registered. Oh my goodness. I've got grandchildren. I've got a granddaughter who gave us a great grandbaby. I mean, I'm really kind of clear that I want to be around for a while. And the last thing I want to have is some notion that at the end, when I could have done something that might have helped me, instead I put myself in a kind of danger, a risk, if you will, that, oh my goodness, I could have avoided. Maybe the most important slide that I can show you is one that comes from the state of California. Now, I know we're not in California, but what I think this slide demonstrates is a very important message about all of the folk who are very likely to be exposed to COVID-19, and as a result of that exposure, might very well become very ill. One of the reasons that we are the ones in the Black community that are most likely to have COVID-19 has a great deal to do with conditions like mine. A whole bunch of us, more than 50% of all Black men, are hypertension. But it's also the case that many of us work in situations where we're likely to have a job that's going to expose us to the virus. There's a thing in medicine called natural immunity. It means that there probably are some people on this planet that COVID-19 simply will not touch. No matter what happens, no matter how much they're exposed to this virus, they won't get sick. But who has natural immunity? We just don't know. As far as we can see, with the rapid rate that this virus has been progressing, if there are people who have natural immunity, there's a very small number of them, and they don't appear to be in our communities. What you will find in this community, in our community, are folk who are in the occupations that you see here: maids, housekeepers, people who do industrial truck operation, chefs and head cooks, customer service representatives, people who do shipping, receiving, and traffic clerks. We're the ones who have public-facing jobs. And with all the people who are thinking it's their constitutional right not to wear a mask, we're sometimes in real danger that in the jobs we do, where we can't refuse service to someone, we may be exposed against our will. I believe that what this sign shows is the number of people, the typical number of deaths that we've had from people who are in these professions, and how much over the last year there has been a big increase in the folks who have died, probably as a result of exposure to COVID-19, or probably as a result of the fact that because all the hospitals and all the doctors were dealing with COVID-19, their asthma, their cancer, their heart disease, their diabetes wasn't appropriately treated. And as a consequence of not getting the appropriate care, they died. But notice that with cooks, in the last year, you've had a 60% increase in the number of people in California who are cooks who have died, where it's probably clear that something about COVID, once again, being exposed to the virus and dying because of that, having a comorbid condition and having that be the cause of death, those are all things that make it clear that with the lowest group on this particular chart, maids and housekeepers, that have had an almost 33% increase in deaths over a year, we are folk who have workers, who are in our community, and whose danger from public exposure makes it imperative that they get this vaccine. So I think I'm trying to make it clear that our community is at the greatest risk for infection. We have the means to reduce that risk. The question, and I'm hoping that now we'll be able to open it up for conversations with all of you out there, is what do we do to help folks who are not yet decided that this is something that they should do? If those are questions you have about your own desires, needs, or questions having to do with getting vaccinated, please, let's have them now. But for many of you who are really interested in the health of the Black community, helping us figure out how to get to that rock steady group that says, I don't care what happens, I'm never going to get this. I think it's really important for all of our safety that we do ourselves a favor, that we take care of ourselves, but we also take care of our neighbors, even those who are doubting Thomases. You know what the Bible says about doubts. This is a moment. This is when we have to rise to the challenge. And I'm really anxious to hear your questions and give what I can in the way of a response. Madam Chairperson, Tanya, if I can turn it over to you, I think Dr. Bryan and I are ready.
Well, thank you, Dr. Fullilove, and thank you again, Dr. Bryan, for all of your information. Before I get to some of the questions, I just want to share that we've put some links in the chat for some information that has been shared, that has been televised. There's something from Joy Reid regarding race and America's COVID crisis. There's also an interview that Reverend Al Sharpton had with Kamala Harris on February 27th that we found very interesting. We've also shared that in the chat. And we've also shared a link to the Advertising Council's campaign regarding the vaccine awareness program. So I want to thank you again, and thank you for those who have stayed on. So a couple of questions that have come up for me. There have been some reports that have suggested that just taking vitamin D, zinc, C, quercetin will be enough to protect you from getting COVID-19. What are your thoughts about people who are more committed to natural therapies than who are interested in medicine in the traditional sense?
Well, how about I take a stab at that?
Thank you.
There was a period of 8 years when I served on the National Institutes of Health, their committee on considering alternative medicines. So for 30 years, I was married to a physician, Mindy Thompson-Fuller, who's an acupuncturist. I believe in natural healing. I believe in, for example, the 5,000-year tradition of Chinese medicine. But what I've also understood with the Committee on Alternative Methods for doing everything in the way of medical research is that we have done our best to combine so many natural methods into the way that we're practicing medicine now. For example, we're really trying to bring midwives back into the Black community to sort of deal with our high rate of infant mortality. I believe that people who are careful about their diet and who are very careful about watching whether or not they're taking appropriate vitamins. Iron deficiency anemia is one of the things that is really a problem for many Black women. I think that's a good thing. But I also believe that adding to that, the things that we've already established as effective in dealing with preventing severe disease is also a good idea. I do not believe that natural medicine and COVID-19 vaccine are in competition with each other. They're just not. They're just not. And so people can provide, I think, a variety of different ways in which you can do many things to keep yourself healthy, to boost your immune system. But what you want is not just a strong immune system. You want an immune system that's making a specific response to the COVID-19 virus. And that requires, as far as we can see, a vaccine. Those are the odds. It might be enough to just take vitamin D, but I myself am not betting on it.
Yeah, and I agree. I also do believe in alternative medicine, but until there's research that actually studies zinc, vitamin D, elderberry, all these things and says that it works, I do believe that you can combine both, boost your immune system, but also take the COVID-19 vaccine. I think there's a way that you can merge the two.
Thank you very much. There's a saying that I've come across: you must master a new way to think before you can master a new way to be. And it seems part of this, whether or not people choose to take this vaccine or other vaccines, or even be an active participant in their medical care, is they have to adjust their way of thinking and their view towards medicine. And I'm concerned about how we can really address those people who are conspiracy theorists, who are very cynical, who are very distrustful, obviously because of Tuskegee, because of what happened with Henrietta Lacks cells, because of numerous infractions that honestly the medical community is guilty of. There are some people who say that the COVID-19 virus was created as a form of genocide. There are people who say that the vaccine is another form of genocide. There are people who say this is all part of the Illuminati. If you ask another person, they may tell you it's the whole devil. So I just wonder, really, can we reach everyone? Can we really change people's way of thinking to the extent that they will be active participants in their health?
You know, I have published a number of articles looking at conspiracy theories because this is pretty much what was being said about HIV, especially if you consider the fact that 70% of all AIDS is in Africa And if you follow the African diaspora in every country where there are Black people, we're the ones who are suffering most from it. So the
Mhm.
one thing I'm clear about with conspiracy theories is it's not about thinking that this is somebody who hasn't thought carefully about the evidence. If you were to put some of this to the world court, there would be all kinds of evidence that systematically since 1619, this country has been engaged in genocide. Where are all the Native Americans? There were about 40 million of them here when Columbus showed up. That's a fraction of the number that's still here. So there are all sorts of reasons to mistrust what's going on when you think about the degree to which American medicine, for much of its history, was a tool of white supremacy. So I'm thinking that almost anybody who's a person of color who does medical science is acutely aware of all the abuses that were there. But here's what's changed in my lifetime. There are more Dr. Bryants, plain and simple. There are way more of us doing this work, coming up with some of the techniques that were used to create this vaccine. So I'm much more confident because we know what we're doing. Folks like us got into public health and medicine because we wanted to make a difference, knowing that so much of white supremacy was bound up in the way medicine was practiced. It was very clear. If we get into the game and we start talking to our people, the way I'm trying to talk to you tonight, the way Dr. Bryant has been giving you the facts about this tonight, that's how we start to change minds. I believe that we'll never be 100% convincing, but I do think that more than anything else, we would like to be judged on the quality of our work. If it turns out that we turn this virus around, then I think it's going to be a moment for us to go back and say, okay, maybe as a community, we might want to re-examine some of our notions about medicine, because I do believe that there are communities of color who are actively engaged in producing good medical science, good public health science, that folk who are from that community, I think should have reason to trust it more and more and more. At least that's my hope. That's my fundamental belief.
Yeah. And I also agree. You're not going to change everybody's mind, and that's not really my role. All I could do is provide, my beliefs, the research, and you cannot deny medical atrocities did happen. All those, Tuskegee, all that actually did happen. But I also, tell people it'd be different if only Black people were receiving this vaccine. A lot of white people are receiving this vaccine. I don't know if that causes people to have a little bit more ease. And I also trust our system, not to say, that it couldn't happen again, but there are a lot of safeguards in place now, so we don't have Tuskegee happen again. So, that's all I can offer is just, those things hopefully will not happen again. We learned the lessons. Like I said, the government is, have these safety measures in place so this doesn't happen again, and trust. That's
I
kind of
think,
The
would
other
you be able, I'm sorry, go ahead.
I just want to add that part of what happened in my own work with COVID-19 was serving on a community advisory panel that was put together by Dr. Fauci at the National Institutes of Allergy and Infectious Disease. There were almost 80 folk of color, all scientists, all people in medicine and public health, who worked to make sure that during the phase 3 trials, all of the communities of color were appropriately represented. We got more of us into these trials than I think we've had in many, many, many clinical trials over the years. And because of that, we're a lot more confident that because it got tested, not just on us, but tested on folk who have the conditions that we know make you ill, are likely to have you become hospitalized, that we have confidence that this thing is going to work. We're not saying that it will prevent you from being infected. What we're saying is you might be infected, but you won't get so sick you have to go to the hospital. And if you don't have to go to the hospital, we're basically saying it's not something that's going to result in your death. So having watched this from the moment that they started doing the test to see whether this would work to right now, I really have a lot of confidence that we've had much more oversight. We've had much more voice. I'm talking about everything from American Indians to people in the Latinx community to Black folks, all basically saying and holding the manufacturers of the drugs to the fire, saying, look, we need to see better results. We need to see more of us here. And that's one of the reasons why I think every single one who served on those panels is taking part in meetings like this, where we're really trying to say, look, as far as we can see, this is where we should go. Just wanted to add that.
Yes. I think many young people don't know of all the successes that have occurred because of vaccines and because of some of the medical advances. Like many young, one of our participants, our co-chair, Ms. Joyce Howard, mentioned that many young people don't know of polio or smallpox because there was a vaccine that pretty much made it so that those diseases are so rare. What other successes would you say the medical community has been responsible for that we can connect to offer some more trust and a better relationship?
Up until the 1950s, most of the deaths in our community were from infectious diseases. What's killing us now are chronic diseases, diabetes, cancer, heart disease. That's literally because our life expectancy, while it's not the same as whites, has been growing steadily. And it's been growing steadily because whatever else has been true, we have benefited by many of the interventions and many of the policies that have promoted a better way to practice medicine and given us a better set of controls over what happens in public health. We have been beneficiaries. We're trying to get to the point where we do as well as everyone else. And one of the ways in which that happens is to prevent all the mortality that we know is going to be associated with this virus. Maybe you saw in the newspapers last week, the life expectancy of people in the United States has gone down by 1 year because of COVID-19. That's for everybody. For Black people, it's gone down 2.7 years. So I mean, we're really kind of clear that it's imperative that Dr. Bryan and I show up in settings like this, because we really got to be clear. We can't let this continue, especially if we have something that will help us. I mean, the greatest tragedy of all would be, yeah, it was out there, but we said, no, I don't trust it. I'm not going to do it.
And if people want other examples of where vaccines work, think about the vaccines that you receive: measles, mumps, rubella, diphtheria, all those things. Do you hear about anybody having those diseases anymore? And no, that's because of the vaccine. Even hepatitis B, that was causing liver cancer. So those are some of the stories you can also share with children who may not know about smallpox, polio. That's the reason vaccines work.
You know, Dr. Bryan, you mentioned that there are protections in place and there are perhaps policies in place to help prevent some of the things that have happened in the past. Can you speak to exactly what those are? Like, what has the medical community done to help prevent another Tuskegee or Henrietta Lacks or other infractions?
I think I could speak on it, but I think actually Dr. Fullilove might be better for that question.
Yeah, because the most important thing about Tuskegee, and there were many, many evils that were associated with it, but the most important was that the men weren't told what they were in. They weren't told about the fact that this is an experiment. They weren't given the right to opt out of the experiment, and then get treated. We had penicillin by 1943. My dad was using it to treat syphilis. And in a really ethical study, the first thing that would have happened is they would have stopped the study and make sure that everybody who was infected would be treated. Right now, anytime any scientific experiment is undertaken in the United States that is sponsored by either the government or a research firm or a hospital or a university, like a research university, which is what Columbia University is, you have to go through a board of ethics review. It's called the Institutional Review Board. And part of what they do is demand proof that people have been told all of the facts about being in a study. What are the risks? What are the benefits? Have they heard enough about what's being done so that they can give informed consent? They've even gone so far as to make sure that if you are in a poor community and you are asked to be a part of a clinical trial, that we won't give you money that might enforce in you this notion, I have no choice but to do something in this experiment because I need the money. So that means that we've deliberately done the one thing that might get us lots of people participating in an experiment. Let me pay you to do this. We're not doing that. We're not doing that. So we've had low participation rates, but one can be assured that everything was done in an ethical manner to make sure that if you are a part of an experiment that's going to help medicine or help public health, that you're told about what you're doing, and that you consent to be a part of it. And that your consent is something that, if it's violated, can cost the organization that is running the study all kinds of money and all kinds of problems in court. So we put a lot of legal standards in place to guide what happens when science is conducted. We've made sure that there is an appropriate review of all the research that's done. For example, if you want to do research on prisoners, there's a prisoner advocate for any institutional review board that wants to make sure that the rights of incarcerated persons haven't been violated. I have served on those institutional review boards, and they are very, very rigorous. They will turn down money if it's clear that the study that's being proposed is going to do harm to individuals and to society as a whole. So it's not enough to say it's guaranteed that it won't happen, but if you look at the things that have happened specifically as a result of Tuskegee, this was brought about by Tuskegee and the Nazi experiments in World War II. You will be very pleased to see how much we are bending over backwards to make sure that when we do research in our community, it is done with ethical standards that we can all basically support.
Amen. I know we have about 7 minutes. I just want to ensure that people know you can either share your questions in the chat, or you can actually unmute yourself and ask direct questions to our speakers. We have some time left if there's anyone who would like to speak.
Yes, this is Lorraine. I just wanted to say, in regards to the vaccine and how we have whites coming into the Black neighborhoods, into the little enclaves, you know, most, anyway, broken down areas. I say this, when a white person shows up for that vaccine, no one says go in the refrigerator and take out the vials that say for whites only. They're getting exactly the same vaccine that you're getting. There's no discrimination here. We are not in a study in that sense. We are not. Everybody's getting the same thing that the world is getting. So, you know, I don't know what else more than we can do aside from what we're doing right now, educating one another so that we can each go back and spread the word.
Beautifully put.
Beautiful, yes. I wanted to end with, I suppose, because I don't see any other questions coming in. I think you two did a great job, really, of covering all of the questions before we even asked them, and I thank you. I want to speak to what is our responsibility. When I say our, I mean the Black, brown, and tan people who are distrustful, who do make it, who don't like to go to the doctor, who may make certain excuses or avoid certain things. What is our responsibility, and how can we actively develop a better relationship with the medical community? What do we need to do?
I want to believe that what you're doing is exactly what should happen much more frequently. I know the NAACP because I was enrolled in 1945 in New Orleans. When I was working in Mississippi in 1965 in Natchez in Adams County, Charles Evers, Edgar's brother, was somebody who was actively engaged in the NAACP. He later became the mayor of Fayette, Mississippi. I remember how much he was about, what do we do to organize our people so that when harm comes our way, we are protected and we're able to continue to march on. I believe that it is the historic job of the NAACP to do exactly what you're doing, to build a bridge between us and this establishment, to make sure that when that bridge is built, we can all go over, we can all progress, we can all get better, because we'll be well informed, we'll be well educated, and we'll feel as if we have some power over the most important decisions that we make about our lives and our health. I mean, I've been somebody actively engaged in the civil rights movement since the beginning, 4 years in SNCC. So I really believe that when civil rights organizations step to the fore and they say, we got to do this, that our community has always followed. So I want to thank you for your leadership. That's what I think has to be done. Provide the leadership that you continue to provide. I salute you.
And I say on an individual level, we need to be role models for our family, for our friends. We as mothers, daughters, wives, we need to encourage our family members to go to the doctor, even if we have to make that appointment and go with them. And when it comes to COVID-19, when you get your shot, take a picture, film it, put that on social media, because I cannot
Mhm.
tell you how many people went to get a vaccine because they said, I saw my video when I got it and how I felt the next day, but
Mhm.
people pay attention to you. So when they see that you got it, you're okay, they may open their mind up a little bit to say, well, maybe I'll get it. Kelly got it and she seems to be fine. Maybe I'll get it. So just spreading the word and again, being role models is probably one way that we can help spread this message.